Leaning into some microbiology here next. There's a lot of key pathogens, okay? So we're going to look at them and just kind of try to do some comparison contrasts because when it comes to bacteria and viruses and more, oh my, the more that we can kind of compare and contrast and come up with some like highlighting features that make things unique, the better we'll be at being able to suss out these micro-based questions on your board exam. So for Campylobacter jejuni, it's the most common bacterial GI pathogen in the US associated with undercooked poultry or unpasteurized milk, and it's curved, it's spiral, it's gram negative. It likes a little bit more of a warmer temperature, 42 degrees Celsius, and it's microaerophilic. Bloody diarrhea is a component that you would see here. So you would have bloody diarrhea, and Guillain-Barré syndrome is your complication. So that's your Campylobacter jejuni. Salmonella, non-typhi. Salmonella is also poultry, eggs, and then unique, strange, and peculiar reptiles, specifically turtles. It invades your pyre patches and goes intracellular into your macrophages. You can see bacteremia, so bacteria getting into the blood in sickle cell disease, HIV in the elderly. And if it's typhoid wise, you'd see a stepwise fever, rose spots, and bradycardia. Shigella, this is a very low amount of exposure to be really highly infectious. It invades the tissue, so you'd see a bloody, mucousy diarrhea. They have a toxin, which is our Shigella dysenteriae or Shiga toxin. This could lead to hemolytic uremic syndrome, and you could see a reactive arthritis, a Reiter syndrome, or even seizures in children. E. coli, which is going to be enterohemorrhagic E. coli, EHEC, specifically the strain 0157H7. Know that. Like this is high yield here, so know this whole thing. Undercooked beef, unpasteurized juice or cider. Also has a Shiga-like toxin, which causes endothelial damage and can also lead to a hemolytic uremic syndrome, where you have microangiopathic hemolytic anemia, decreased platelets, and an acute kidney injury. So bad stuff going on. There's bloody diarrhea here, no fever. That can help you distinguish from an invasive gastroenteritis. And that is like your high yields for EHEC. Yersinia colitica. This is often seen in pork products or unpasteurized milk. It invades into the terminal ileum and right lower quadrant pain. It kind of looks like an appendicitis, it's a pseudoappendicitis. You'll associate it with mesenteric adenitis, and it can also give you a reactive arthritis or an erythema nodosum, the painful kind of circular red circles or deep purple circles on the shins or lower legs. And then E-tech, this is going to be a traveler's diarrhea. This is also an E. coli. This is going to be your contaminated food and water. You go somewhere, you eat the bad food, maybe the good food, but it's contaminated and you get sick. There is a toxin. It leads to ADP ribosylates GSA, which increases cyclic AMP. Kind of looks like a cholera presentation. You also have a Shiga-like toxin, which activates guanylyl cyclase, which increases cyclic GMP. So it's a super watery diarrhea, but there's no invasion into the tissue, so there's no blood, which makes it unique. Vibrio cholera, this is cholera toxin. Again, that ADP ribosylates GSA, which leads to a lot of cyclic AMP, chloride secretion, and your rice water stools. So this is your classic rice water stool. Fecal oral contamination of water, painless diarrhea, no fever, but lots of electrolytes being lost that could lead to death. Our C. difficile, our Clostridium difficile, is associated with recent antibiotics like clindamycin or others and hospitalization. There is an enterotoxin, toxin A, plus a cytotoxin, toxin B, that could lead to a pseudo membranous colitis. Again, antibiotics hospital associated. Staph aureus food poisoning, we think of like mayonnaise as like your classic piece. Pastries, potato salad, room temperature. You also want to, you also could see this with essentially you're consuming this preformed heat stable enterotoxin, which is a super antigen. The onset is pretty quick and it can lead to explosive vomiting and diarrhea with no fever. This would be your classic multiple people sick after the same meal at a picnic or cafeteria. Bacillus cereus is fried rice. The spores can survive cooking because this can create an endospore and then it can sporulate at room temperature. There's an emetic or diarrheal form. The emetic form is from eating preformed toxin, which looks like Staph aureus. A diarrheal form, which is an enterotoxin, which is more like Clostridium perfringens. Both are self-limiting. Listeria monocytogenes, this is your unpasteurized stuff. This is the concern for pregnancy. So, unpasteurized dairy, deli meats, soft cheeses, hot dogs. It grows in cold temperatures, refrigerator temp. And so, pregnant women, it's high risk because of neonatal sepsis or meningitis, as well as elderly and immunocompromised. It escapes the phagosome when phagocytosed and via Listeriolysin O, and then it can spread intracellularly. This is claim to fame. And then H. pylori, we already talked about this. It's gram-negative spiral. It has urease, which it allows it to colonize the antrum of the stomach, creates a little ammonia alkaline buffer, and cause mucosal damage, leading to peptic ulcer disease, more in the duodenum than in the stomach, can lead to chronic gastritis, and can ultimately lead to an increased risk in adenocarcinoma. All right. Transitioning from bacteria to protozoa and viral pathogens, Giardia is from a contaminated stream, think hiker, fecal oral spread, and an IgA deficiency risk. The trophozoites attach to the duodenum in the small intestine and lead to malabsorption, but they don't invade. You'll get a greasy diarrhea with bloating, almost kind of like a SIBO or IBS-like picture because there's no blood and no fever. Enterolytica Enterohistolytica. This is or Enterococcus histolytica. This is fecal oral spread in developing countries with travel. It is invasive. There'll be these flask-shaped ulcers with bloody mucousy diarrhea. You can see a liver abscess present. Red blood cells get inside these trophozoites. Essentially, you get erythrophagocytosis, which is pathognomonic for this condition. So I would say flask-shaped ulcers and erythrophagocytosis would be your high yields for histolytica. Cryptosporidium parvum, contaminated water as it can survive chlorination. So we see this in pools. Oftentimes in an immunocompetent person, it's just a watery diarrhea. But in a patient who's immunocompromised, like an HIV/AIDS, it can look like a cholera-like involvement or cholera-like illness, and it could be fatal. Norovirus is the most common cause of epidemic gastroenteritis worldwide, versus rotavirus is the most common cause of severe diarrhea in children under 5. So, norovirus, think more adult GI, rota, think more of kiddo GI. So, norovirus, it's a calcivirus, it's fecal oral spread, fomites, droplets, the whole 9 yards. We oftentimes think of it as, cruise ships or conferences. It's an explosive watery diarrhea. There's no vaccine, so it's really just contact droplet precautions. Versus rotavirus is a dsDNA reovirus, more common in the winter with a watery diarrhea, vomiting, and there is a vaccine available for this virus. And then Cyclospora catenaceous, less common, I'd say lowest yield of this list, but contaminated produce, rose, raspberries, and herbs, water travel, more of a watery diarrhea. It can be a longer course. And uniquely, it has an acid-fast stain, kind of, which unique comparison, Mycobacterium tuberculosis also has an acid-fast stain. So this is kind of your like reference table. Obviously, you don't need to treat any of these. That's fine. But knowing the pathogen, knowing kind of in general the onset could be helpful with a clinical vignette. Really knowing pathogen and source is going to be the most helpful. And then stool type, being able to say like, is this watery versus mucousy versus bloody versus other? And then is there any special features associated? So these would be kind of like your high yield GI pathogen conditions to be able to have and be able to compare and contrast. There'll be at least a few of these represented on your NPLEX exam. Some final thoughts here overall, reminders to kind of some of the GI infections. But again, if you study this table, you should be golden.